And good evening, everyone. Thanks so much for being here. This is the second in our series of 6 Best Talks this semester. We'll be right back here next Thursday evening, actually, with Stephen Woolsey, who is the Assistant District Attorney out in Denver for the state of Colorado. Fantastic alum that will bring a lot of value. So I'd encourage you to join us again next Thursday night. But our guest tonight is Dr. Scott Zimmerman, and I've had the opportunity to get to know Scott over about the last 6 years or so, down in the Raleigh-Durham area. And it took about 5 minutes for me to go, wow, this guy's special. He is representing Houghton in a way that I want to see our alumni representing Houghton. And more importantly, he's representing Christ in the way that he is serving. And I think at the conclusion of that, I'm like, Scott, when's the last time you were on campus? We need to have you back. So this has been a bit of a journey. Dr. Zimmerman was originally scheduled to be here 3 years ago, and we had to postpone that. Then he was originally scheduled to be here 2 years ago. Well, if you know what was happening just about 2 years ago, I think it was a week before he was supposed to come, and he's like, Carl, I've been sequestered by the state of North Carolina, and we're trying to figure this thing out. So the coronavirus. And here we are 2 years later, and we're thrilled. So Dr. Zimmerman has been on campus since this morning. Some of you I know have had an opportunity to hear him in class at the Math and Science Colloquium. Please take the opportunity. This is a small group. It's informal. If you have a question, you have a thought, please don't hesitate to ask it. Please don't hesitate to share it. I know he's willing to hang out and be responsive to whatever you have to share. So from the class of 1981, please welcome Dr. Scott Zimmerman.
Well, thank you, everyone. Thank you, Carl, for making this happen. My apologies that it's taken this long. Some things are just out of your control from time to time, and unfortunately that was it. But I vowed that I would get here at some point. I was nervous the other day when I saw snow in the forecast. I can't do this to Carl and to the college again, but here we are. And boy, has it been a great day. It's been just a phenomenal day here being back on campus. As Carl said, it's been a while for me. I can't tell you exactly when the last time I was on campus, but it was more than 15 years ago. I know that for sure. And I've shared with a few, and including your president this morning, that it struck me on my drive down from Buffalo this morning that it's been 40 years since I was a student here on this campus, and it doesn't seem at all possible. But there's just a sense of familiarity, and that really has touched my heart. Just being here, in a setting that meant so much to me at the time and has continued to mean so much to me over my life and career. So, when Carl asked me if I would do this, I thought long and hard about, what would be something that's impactful and meaningful to students, to faculty, etc. And needless to say, we are dealing with kind of a society-changing moment, if you will, with the pandemic, with COVID, and all of the fallout that has come from that. But I didn't really want to just focus on COVID alone, and so instead, I thought I would talk about really my career, which I'll get into, but my career in public health, and where I see public health currently, and where I see public health going. The title of my talk tonight, Public Health in Crisis, What Can We Do? Sounds a little negative. I'm going to turn some positivity into that. But I am concerned about where we are as a country as it relates to public health, and I'll share some of that with you. So tonight, I really want to focus on 3 things. Things that you can take away, if you will. First of all, a little review of current events. We're going to talk a little bit about the pandemic. I know everybody's tired of it, including me. But I think it's a good way to kind of establish where we are, if you will. Secondly, I want to talk about what this pandemic has done to the field of public health. And it's monumental, been monumental, and scary in many ways. We'll talk about that. And then third, and probably more importantly, and here's the positive aspect, I'd like to end on a positive note. What can we do? What can we do as a society, and what can we do as Christians as it relates to public health and the types of crises that we have been dealing with now for the past year or so? 2 years, actually, I guess. So, little review of current events, if you will. I think these things are probably fresh on our minds in many ways. We hope they go away, admittedly. But let me take you back a couple of years to January of 2020, when there were rumblings that, there was this virus that was coming out of China that we were concerned about, although early on the thought was, well, at least it's not influenza, which we had been preparing for decades, literally for decades in my career. We had been talking about developing plans in government public health around how we were going to deal with an influenza pandemic. So, this coronavirus thing, it can't be that big of a deal. Well, we all know how that turned out, don't we? So, thinking back to mid-January of 2020, when CDC confirmed that first laboratory case in Washington State, you remember it? It was pretty significant. We were thinking like, oh boy, here it is. It's now made, and we knew it was inevitable that it would be in the US, but now here it was. And so there our journey began, so to speak. Things have changed, things have evolved. There's been milestones, if you will. This is just a snapshot of that first year or so. And we've learned a lot. We've also been impacted a lot, obviously, through cases, through death, etc. But if we just kind of look at some elements of this timeline and look at the progression of how COVID-19, SARS-CoV-2, made its way through the population here in the United States. Back in March, now a couple of months into the awareness that we had cases here in the US, the WHO, World Health Organization, declared that COVID-19 is a pandemic, in fact, right? And what's the definition of a pandemic? It's an epidemic that is largely worldwide. And it had spread at that point, to all ends of the earth. And we knew that we were dealing with something pretty significant. 2 months into this, we had recorded some 4,000 deaths worldwide, didn't know where that was going to end, didn't know how that was going to progress, but it was starting to churn up. Even as early as March of 2020, we were starting to see evidence of variants, of mutation. And early on, scientists that I was familiar with and dealt with, including one of the world-renowned SARS researchers at UNC Chapel Hill, where I live, Ralph told me that, it's probably unlikely that coronavirus is going to mutate that much. It's just not the kind of virus that typically does that. So, we're thinking that maybe we'll be okay. We're going to be on a course that we're going to be able to deal with. Well, didn't really work out that way. By April, we're now up to 1 million cases across the world. And so there was this understanding and this this awareness that we were seeing cases ramp up quickly. And so as we move through 2021, reminders that all along the FDA and pharma are working on vaccines. We recognize that there was going to be a need in order to mitigate what had now become a pandemic, a significant threat to the human population. We see that the U.S. Food and Drug Administration approved a drug that has proven to be somewhat useful. There's better ones that are out now. UK in December of 2021 became the first country to approve a vaccine, short of Russia's vaccine that really never went through the scrutiny that we would have expected in our nation. The Pfizer vaccine became the first COVID vaccine, quickly followed by the Moderna vaccine in late 2020. And as we moved into the next part of 2021, again, we're still seeing a rapid increase in the number of cases and deaths. And so the time period between that first million and the second million, and then the 2 million and 3 million, it just became shorter and shorter and shorter as we saw the curve increase. So again, these are just reminders of what we've dealt with and where we've been over the last 2 years. I don't have a slide that really depicts what's happened in 2021 and 2022, but we know significant relevant events occurred. For instance, in the summer of 2021, when the Delta variant really kind of took hold and really just superseded everything that we had been dealing with the original virus. Now it was Delta. And the misunderstanding, the lack of knowledge around what Delta really meant in terms of transmissibility, in terms of fatalities, mortality, and we learned, and we documented, and we studied data so that we eventually perhaps could predict some of these outcomes. I talked to the epidemiology class today, and we talked about predictors. We talked about what it takes in public health to be able to forecast and predict what's happening. Really huge tools that take us forward. So it's certainly been a challenge the last 2 years, but it's not a challenge that was unexpected. It was not a challenge that was unexpected, and this might be a little bit difficult. It's very fuzzy looking, but this is intended to sort of demonstrate the history of pandemics that mankind has understood. And we've had countless pandemics over the years. For all intents and purposes, we were predicting that a pandemic, probably influenza, was long overdue because across the centuries, generally speaking, there are somewhere typically between 2 to 3 pandemics every 100 years. For every century, 2 to 3 pandemics. Some larger than others, some more that produce more mortality and fatalities. And so as we look at this over the course of time, we go back, long time ago, and we have good evidence now that organisms, bacteria like Yersinia pestis, that's responsible for the plague, the Black Plague in the Middle Ages, it kept rearing its ugly head every so many centuries or so. And we were talking about millions and millions of people who would succumb to that. Obviously, during a period of time where we didn't have the technology, we didn't have the medicine that we have today, and we've made a lot of strides because of that. But pandemics have hit us, hard over the course of time. And there's been some huge ones, there's been some that are just not quite that large, but from a predictive standpoint, we've all known and we've all anticipated that we were long overdue for a pandemic. As I said, in public health, we had been planning since the late 90s, early 2000s for what we thought would be an influenza pandemic. More than likely, we thought it would be avian, although in the late 2008, 2009, swine flu was a risk for us. You might remember swine flu. Never really took hold the way we thought it might, but I think some of our actions from a public health and medicine standpoint really curtailed some of that. But again, long overdue. And so lots of planning has gone into place around our knowledge of pandemics. What you can't see here on the bottom of the screen, and this is a little bit of a dated slide, but that little dot towards the bottom is actually COVID-19. At the time this slide was made, we were dealing with a couple 100,000 deaths. At this point, now in late or early 2022, we're somewhere probably close to 6 million deaths recorded. And how many deaths that never really were defined as a result of COVID, occurred. Hard to say, but again, doing a better job, I think, of collecting that data. Here's a Time magazine article from May 15th of 2017. Are we ready for the next pandemic? And I was sharing with Carl earlier that my second oldest child, who at the time was a student at East Carolina University, and for whatever reason, a class that he was taking required him to have a subscription to Time magazine, and he stuck this article or this rendition of Time magazine in the mail, sent it home, and there was a sticky note on it, and it said, "Dad, we had to read this. I don't know everything that you do. I know a lot about what you do, but I think you're the one that can save the world." And I still have that copy at home. I couldn't find it. I wanted to bring it with me, but it really touched me that, even my own son, recognized that the work of public health is really important. So here we are, just 5 years ago, recognizing that again, we're due for a pandemic, and are we ready? Are we ready? We were concerned that all the preparation that had gone into plans, working through with different agencies what would happen in the event of a pandemic might not be enough. And so here we are now, 2 years into this pandemic. Have we done a good job? I think that there's been a lot of deficiencies, and we'll talk a little bit more about that as we go on. And so, brings me to this quote from an academician at Columbia University who deals in public health history and such. And David Rosner says that health has always been something that we basically unite around. Even reading in the Bible, there's so many excerpts in the Bible that really refer to public health, to sanitation, to health-related aspects. We unite around health-related issues. And for centuries, government has maintained a responsibility to, in my eyes, doing two primary things: protecting the public from a safety standpoint, and you could add security to that, and from a health standpoint. Two major functions of government. Not the only ones, admittedly, but tenets of government that just have seemed to be understood, that it's government's role, government's responsibility to protect the public's health and protect the public's safety and security. So we think about law enforcement, we think about fire prevention, we think about public health. These are roles that government, since the founding fathers of the United States, have taken to be requirements, if you will, about government. It's the one function of government, as David Rosner says, that usually is not questioned in any great degree. It's the right of government to protect its people. Well, that dialogue today has really changed quite a bit. And that's one of my grave concerns about where we are as a society as it relates to public health in the United States, public health worldwide. Where are we and where are we going? Public health does a myriad of things. And as I've told some of the students today, as you're thinking about careers as students, whether it be a science career, whether it be a non-science career, there's roles for all of you in public health. And I'm doing a little recruiting tonight, okay? So forgive me, but you'll see why I am when I talk about some of the details. It's not all about science though. It's about communication, it's about business. There's so many different skill sets that really make the world of public health go around. And as I was sharing with the immunology class that I spoke to today, and with the epidemiology class, a few questions came up around data, the importance of data, the importance of facts, etc. And I said, I've got a take-home message for you. As scientists, as burgeoning scientists, but as those who are driven, into a science field because of your passion for it, there is such an important need for you to be able to communicate what you do in that world of science. I said, we're all trained to use data, to use facts, to use graphs and charts and all those sorts of things that help us make our point. But make sure you know your audience. Understand who's listening to you as a scientist speaking. And you can't always use that. You can't always use that approach. And I learned early in my career that throwing up charts and graphs and whatever might work with some peers. It works with peers sometimes. But that's not always the audience we as scientists are talking to, right? We're talking to others. We're talking to lawmakers. We're talking about funders. We're talking to community-based organizations. We're talking to faith leaders. We're talking to all different kinds of people. They don't all get science. And so as scientists, my plea to you is learn how to tell a story. Learn how to tell a good story, because that is going to make a difference. That's going to make a big difference in your career, learning how to tell a story. And so I've given this example, and I think there's maybe only a few of you here who've heard this example already today, and forgive me, but I think it's such a good example, a learning example, if you will, around how to be successful in life, but also in my field of public health. Soon after I joined the North Carolina Department of Health and Human Services, we had some discussions around our newborn screening program, which is a mainstay program in the world of public health. Newborn screening, for what you may know, is a nationwide program. Every state has a newborn screening program, and it's intended to identify rare diseases, mostly inherited type diseases in young children, newborns in fact, early in their life, so that the proper modifications to their lifestyle, proper treatments, proper procedures can be put in place to prevent them from very serious and ill effect type situations. Today, 2022, there's probably close to 65 different disorders that are part of the state's newborn screening program. First one that ever existed 50 plus years ago was PKU. A physician in Buffalo, New York, my hometown, had a child born with PKU, and he recognized that if he removed from his child's diet amino acids that are found in milk, breast milk included, he could moderate his child's progression. Without removing that, his child would have serious central nervous system issues. In fact, in many cases, may not survive a long life at all. And so, when I got to North Carolina, we were considering additions to the newborn screening panel. And one of the additions that we wanted to make was a fairly recent discovery around a disease that now had some good data on how to moderate the effects of that disease. The disease was known as severe combined immunodeficiency, or SCID. Some of you may be aware of it because there have been a number of movies made, one of which was the Bubble Boy movie, where a young child who had this disease, which is a genetic mutation, could not be in contact with other human beings because he had no immune system for all intents and purposes, and coming in contact with humans who may be carrying, transmitting viruses, bacteria, or whatever, was potentially lethal to him. And so we had learned in recent years that a bone marrow transplant, generally before the age of 3 months, was a cure for SCID. You could do a bone marrow transplant on a young child and they would be cured. They would be able to lead a normal life. And so with the testing that we had available to us, we proposed to our legislator, our state legislature, that we wanted to add SCID to the newborn screening panel. And it was my responsibility as director of those programs to go before the legislature. And I thought, well, I'm going to really wow them with some really solid science and some really solid epidemiology and data. And there on my presentation, I had charts and graphs and all this and that and whatever. And at the end of my presentation, the chair of the Health and Human Services Committee nodded at me, said, "Thank you for your presentation, Dr. Zimmerman. Next topic, please." And I said, wait a minute. I said, I'm here because I'm requesting, admittedly, several $1 million in funding to get this program started. Where do we stand? And he said, we'll get back to you. And when he did, he said, thank you, but we're not planning to fund that. It was a lesson. It was a hard lesson to learn. But I didn't give up. And so the following year, when it came to budget time, I said, okay, we're taking a different approach. We are going to tell a story to the legislators, because they don't necessarily understand science, and why should they? They have different walks of life. They didn't understand some of that. And so I went to a colleague who I had met several years earlier at Duke University, Dr. Rebecca Buckley, a world-renowned immunologist. She happened to be 82 years old at the time, wonderful grandmother-looking individual. I said, Rebecca, you have to come with me to the state legislature to help me tell this story. And there's one other person that we're gonna recruit, and that's the mom of a child who happened to unfortunately die from SCID long before testing was available. She agreed. She said, I need to be an advocate. I need to be an advocate for newborns who can't speak on their own behalf. And so we put together a program. We went to the state legislature. I gave my talk about why this was important, the economic impacts of it, et cetera. Dr. Buckley gave the medical expose, talked about how bone marrow transplant would cure these children. And then we introduced the mom. And the mom talked about losing her 1-year-old son due to an infection after having been hospitalized multiple times in that first year of life. And they couldn't save him. And she looked at the legislatures, looked them in the eye, and she said, for the price of one of your lunches today, my child would be here with me today if you would approve newborn screening in North Carolina. The chair of the Health and Human Services Committee pounded the gavel on the table and he said, we need to hear no more. This is approved. We are funding the newborn screening program. It was telling a story, folks. We brought science, it was based on science, but we told a story that made a difference. And yes, it was tugging at heartstrings, I get it, but these are real stories. These are real people. Public health is about real people. There is such a cross-section and intermingling with the values that we have in Christianity and public health, which is what brought me to this field. The training that I got here, the education that I got here at Houghton was more than just the biology that I took, more than the chemistry that I took. It was about relationships. It was about the social aspect, the community that we lived in. And I think that's what attracted me to public health. There's so many similarities between that and our Christian values. When you think about the values that we have as Christians, and I compare those to some of the things that we do in public health, what do? We're seeking to assure that the most vulnerable are taken care of. Those who have the least are cared for. So many similarities. I am just taken aback by all of that. But before I get into all that and how we can fix this problem that I see, let me talk a little bit about where I see some of the issues are that in some cases have been a product of the pandemic. Not in all cases. Public health in general has had a declining funding over the last maybe 20 to 30 years. But as a result of the pandemic and as a result of the incredible divide that our country sees right now from a political standpoint, from a mindset standpoint, state legislators in every single state in this country have had proposals to change laws to diminish the authority, to diminish the power of public health. And when I talk about the power of public health, what I'm talking about is a government agency that has the ability, that has the authority, legal authority, to assure that communities are safe. The authority to quarantine. What does that mean? To identify someone who has a communicable type disease, an infectious disease that could have major impacts on the community they live in, and quarantine them for a period of time to help prevent the transmission of that disease within the population, within the neighborhood, within the community. Every single state has had legislation proposed to minimize that. 50% of the states have actually introduced new laws to restrict public health actions. We've all heard in the news, we've all read about some of the things that are being challenged in our society with regard to what public health tries to do. The challenge with vaccines, the challenge with mask mandates, all of these things that are designed to help mitigate the spread of an incredibly lethal virus, but a tremendous amount of challenge that's fostered and fired by, I think, a number of different reasons. But these are challenges to us. These are challenges to our society. And because of that, because of some of these challenges, we've seen a massive decrease in public health professionals, the workforce itself. There was a survey done probably about 4 or 5 years ago by the Association of State and Territorial Health Officials and the National Association of City and County Health Officials. No one really had a good handle on how many public health professionals there were in the United States. But the survey that was performed estimated that in government, both state and local government, there's probably somewhere between 225 to 250,000 public health professionals nationwide. As a result of the pandemic, we have seen an incredible decrease in those numbers of public health professionals. People have left because they're burned out. They're working 16-hour days. They can't deal with it. The public health workforce is an aging workforce. I'm a good example of that. Take an aging workforce with one that's being asked to work 16-hour days on end, a lot of burnout. People were leaving. People were retiring. And unfortunately, a lot of officials were being asked to leave. They were being terminated because they were making decisions that they thought were right for the public, but the public didn't appreciate it. They felt that rights were being stepped on. They felt that their rights, individual rights, were in jeopardy. And so people were being asked to leave by state legislators, by governors, et cetera, et cetera. So we've seen a marked decrease in the number of government public health workers just in the last 2 years alone. In fact, the Association of the American Public Health Association estimates right now that in order to get back to pre-pandemic public health professional numbers, we need to hire 80,000 people in this country right now. Right now. So think about that number that I threw out just a little while ago, 225 to 250,000 nationwide at local and state public health departments. We've lost 80,000. We need to replenish that, and even then, that's probably not enough to get all the work done that public health does. So, are we in a crisis? I think we are. I really think we're in a crisis, and we need to do something about that. Over my career, I have experienced from time to time that when a crisis occurs, the federal government, usually Congress, will step in and say, we're going to fund the issue that just caused this crisis. And admittedly, that funding is typically short-lived. It will last maybe 3 to 5 years or so. And of course, as this pandemic began to evolve and become more realistic, there was hope that perhaps the same approach would be taken by the federal government, by CDC, by the NIH, by Congress, et cetera. We thought there was going to be a renaissance in public health, but we've seen over the last 2 years, in fact, just the opposite, that there's been a major decline. I am holding out hope, folks, that we're going to reverse that. We are on that trend, admittedly, but I really have the hope that we're going to be able to reverse that. And I'll share with you some of my thoughts about why that is. I really think that there's opportunity, an opportunity that will come out of this pandemic. Inasmuch as I've just described a very negative scenario around the decline in the workforce and the abuse in some ways that some of these folks have had to deal with. There's no question, I think, in my mind, and I hope in yours, that there's been an increased awareness around the role of public health. In some cases, it's been negative, I get it, but people are aware that public health exists and that perhaps some agree that there is a role for public health. So, just a simple awareness alone, I think, is opportunity. I think there's opportunity because awareness now exists. You could go walk down the street on any given day a few years ago and you would ask somebody what they knew about a public health department, they wouldn't know very much at all. In fact, I can tell you that I've seen some misinformation, some comments in social media that clearly define and describe how people don't understand what public health professionals do in this country. I think another outcome of the COVID-19 pandemic has been a recognition that, you know what, we're all vulnerable. You know, there's really not a lot that differentiates one from another in terms of our vulnerability for this virus. It's shared vulnerability. It's a common humanity. And I think that recognition alone says a lot about opportunity. That we are all created equal, and that we are vulnerable together. And so we, corporately, as a community, really need to create the solutions and find what's necessary. The last point that I talk about, and this is where I'm going to lead us into a more positive approach and a more positive message, is this concept of public health 3.0. And let me describe a little bit about what that is. Again, probably a little bit difficult for some of you to see. This zone of inhibition here that I call it here is what I'm used to when I give these talks or whatever. But let me help you with what we have up here. So when did public health really start to take root? It was the late 1800s, and a large degree of that was a result of our understanding of what, if any of you are biology majors, you'll know this well, Robert Koch and the germ theory, right? We started to understand in the late 1800s that there were these infectious organisms that apparently were responsible for some of the disease and things that we were seeing, whether it be related to water, drinking water, whether it be related to the air that we breathe, you name it. You know, some of the foundational studies in public health happened in London, England, around a water pump. That it seemed that people who would drink water from that water pump were more prone to getting gastrointestinal distress. But if they went to this water pump, it didn't happen. What were we dealing with? We were dealing with cholera. And that was John Snow, the founder, if you will, of modern epidemiology. John Snow has a statue and a golden pump in downtown London that commemorates that. Our discovery of the germ theory, if you will. So public health had its beginnings in the late 1800s around our understanding of infectious diseases, etc. It was starting to take off. The late 1800s, we saw a laboratory developed in New York City, which ultimately became the precursor of the NIH, which is not in New York City, but in Bethesda, Maryland. But that was the beginning of laboratory science around public health. And so there was a lot of growth that occurred from the late 1800s until, we'll say maybe the mid-1980s, around government public health and the role it plays in assuring the community's well-being, the community's health. And then, beginning with an Institute of Medicine report in the mid-80s, The Future of Public Health, it really talked about a more systematic approach and development of public health in government agencies, broadening the horizon of public health departments to deal with human aspects, food safety aspects, water safety aspects, animal aspects, really developing that. But again, limits. Funding was not available to necessarily do all of these sorts of things. But that was kind of the development of Public Health 2.0, which brings us to Public Health 3.0. A little bit more of a current concept, if you will, that is maybe 20 years old, if that, really. And what it's about is engaging multiple sectors. Public health departments can't do the work all alone. They can't do it by themselves, and so they need to engage. We, as public health practitioners, need to find ways to improve the so-called social determinants of health. And this is something that we're embracing, that I think is a nation, we're embracing the social determinants of health, access to health care, etc., built right into the public health mindset. And so Public Health 3.0 is really about the interrelationships between policy and practice. It's about collaborating, cooperating, coordinating, And all of these elements that you see on this sphere are really part of that Public Health 3.0. It's not just the gray public health, government public health department at the top. It's education, it's the military, it's law enforcement, all interacting and interfacing in ways to improve the health status of the communities that we live in, the nation as a whole, etc. And it's embracing the idea that health equity matters. Health equity is really what the focus of Public Health 3.0 is. And equity is one of those foundations in our Christian philosophies. So, let me bring us to the point that I want to make with you, Houghton students, Houghton faculty, visitors, etc. And my focus is just one element of where I think we can improve what's happened in public health and how we can take public health to the next step. So, just like culture, our faith can act as a social determinant of health. Compassion, mercy, love are fundamental parts of the religious values. They're tenets and doctrines, and they're adhered to by many persons of faith. And together, I believe that public health and faith can find compatibility. That together, public health departments, faith-based organizations, community-based organizations can form alliances, collaborations to really serve elements of our public, of our communities, of our neighborhoods. It can go a long way towards that. Think about some of the scripture. Is this not what we profess as Christians? And is this not what public health is all about? Whatever you did for one of the least of these brothers and sisters of mine, you did for me. Right? I mean, our values as Christians. Seeking those who need assistance. Seeking those who need food. That need something. And that's exactly what public health is. And again, I go back to my days here at Houghton, and I think the education that I got, the well-rounded education that I got as a liberal arts college, a Christian liberal arts college, developed me for this public health philosophy. I'm so thankful for that liberal arts training and education that I got. Because, yes, at my core, I'm a scientist. But in order to be a successful scientist in my world of public health, I need much more than that. I need the skills that a liberal arts education brings home. And I'm so happy that I chose that. There's an element in this idea of public health and Christian values around justice. And we hear a lot about justice these days. And I think about this scripture that Christians are called to bravely pursue justice. And honestly, I think in the programs that I've both headed and am aware of in public health, we as public health professionals and we as Christians, we bravely pursue justice. We should bravely pursue justice to assure that, again, the least of our brothers and sisters are taken care of. And so I think there's a lot of synergy between what we can do as Christians, as Christian leaders, and Christian disciples, and how we can work with public health. And so here's a few ideas for you in terms of perhaps a role for us as Christians. What can we do as Christians? There's a concept in the world of science that's been referred to in recent years as citizen scientists, people who are interested in the environment, who are interested in animal health or human health. Maybe you don't have a degree in science, maybe you don't have a career in science, but you can be a citizen scientist. And we have found in public health that citizen scientists lead to some really wonderful outcomes in our world, because we've got people in the community who are really invested in understanding science, in promoting science, in research, if you will. People who might not have the training, but they have the interest, and they're willing to participate in citizen science type activities. And so I I suggest that as citizen scientists, members of our community can challenge inaccurate and harmful messages. A lot of misinformation out there about this pandemic, folks, I have to tell you. And you know, as Christians, to assure that justice is being done in our jurisdictions, in our communities, in the country, in the world, we have a voice that I think can go a long way to making a difference. We can condemn violence, you know, that pertains to, you know, a myriad of social aspects of our everyday life right now. But stand up, assure justice, make sure that those who are oppressed are taken care of. Leverage your networks, you know, do some research, look into some real hard data to understand that, you know, in fact, perhaps what we're hearing out there isn't necessarily true. How can we support public health messaging? And I'll be the first to admit that over the last 2 years, public health has had a number of missteps when it's come to messaging. You know, the public health communication in a number of instances has been less than ideal. And I'll take that right up to CDC. That, you know, CDC has had some missteps in the way they've communicated things. So public health messaging is really important. And for those of you who are considering a career in communications, by the way, there's a home for you in public health. Public health doesn't mean, again, that you have to be a scientist. It doesn't mean you have to have a degree in public health. We are looking for people who have good communication skills. We are looking for people who have good you know, social skills. We're looking for people who have backgrounds in psychology and sociology. There's a lot of opportunities there. And bringing our Christian values to that will go a long way. I've had the pleasure and the privilege of working side by side with a number of public health professionals who have, with me, professed their faith. And I watch them and I see how they lead people, and I see how their heart is in what they do every day. Those of us in public health didn't do it to become financially rich, but we've all been enriched. We've been enriched by the lives that we've saved, the lives that we've impacted. Living in a community that you can give back to is incredibly rewarding. Trust me. You know, every day I think about the community that I live in, and that some of the things that I did during my 25 years in public health were having an impact on my neighbors. And that's incredibly rewarding, I have to tell you. Last but certainly not least, by any means, support the continuity of education. You know, again, I think there's been some missteps, there's been some misnomers, misidentification, and misinterpretation of things. And educating our neighbors, etc., I think is a value that we are charged with as Christians, making sure that messaging and the importance of education is taken care of. So, let's get a little bit more specific. When I say, what can Christians do to take action? Here's a few ideas that I think make a lot of sense, and I hope they resonate with you. We have seen a remarkable increase over the last, I'll say, 10 to 15 years of denominational sponsored healthcare activity, we'll call it. And again, during the pandemic, how many of you have heard about, you know, churches that are hosting vaccine clinics or testing clinics or whatever? This is getting at the grassroots of our community. Where do many members of our community migrate to? They migrate to our faith-based organizations, to our churches, you know, to our synagogues. Denomination-sponsored events, you know, can go a long way to bringing people together, but also uniting public health with faith-based organizations and with Christians. Medical and public health missions. You know, we've been doing this forever. But again, opportunity, I think, for advancing public health initiatives, Christian values, etc. Chaplaincy in healthcare settings, pastoral care, wonderful opportunities where we can promote some of these ideas around public health and the values of Christian-based philosophies. Congregational-based health promotion, disease prevention. I couldn't even begin to tell you the number of churches that I'm familiar with, again, both in New York during my tenure, 18 years in New York State, but also in North Carolina, where seminars were being put on by the congregations around public health issues, challenges to communities, to populations that made up these congregations. It's a wonderful resource, an absolutely wonderful resource. Community-based outreach to special populations, you can equate that to faith-based outreach as well. And clinical and population health research on religion and spirituality. Again, just a very short list of some recommendations, some ideas that folks have had around the role for Christian action. So, I think there's a lot of hope for the future, for our society, for public health, and for the advancement of our Christian thoughts, our Christian philosophies. Even though we're in a society that has an increasing focus on individualism, we, as Christians, have the opportunity to promote the concept of community. And community is so valuable. Individualism, I think, will destroy us. Community will make us thrive. In community, we muster resources together and the capacity to achieve health, healthy situations, healthy lifestyles, wellness. And in healthy communities, we know there are healthy people. And that is our goal. That's our goal, to develop health equity amongst our people. We need to remember that public health is not just about reducing disease, but it's about giving the best possible chance to those who may be affected by health-related issues. And again, it's more than just communicable disease, but chronic disease, inherited diseases, etc. Public health, largely, ideally, is about prevention. Prevention saves lives, saves heartache, saves dollars, and prevention is a huge effort that takes education, that takes awareness, that takes a community approach. So I really think that things are going to start to look upward, folks. I really do. Part of the reason that I wanted to give this talk is because, as I said earlier, I'm on a little bit of a recruiting mission. You know, I want to encourage those that maybe haven't completely figured out a career path yet, that there may be some opportunities for you in the world of public health. And it's not just government public health. There's other ways that you can contribute to public health. But I really think that there's some marvelous opportunities. And again, it just doesn't always require a science degree. If you've got a passion, if you have a heart that really fosters those Christian values, there's a place for you in public health. And I firmly believe that. I've been blessed by this institution. I've been blessed over the last 40 years since I graduated from here to be part of this public health movement. I'm impassioned by it, if you can't tell. I love what I do. I've told students over the years that I've taught that the day I go to my office and say I have to go to work is a day that I go find something else to do, because that is not work. I don't want work. I want something that I embrace, that I love. And I have never thought of this as a job or work. This is my life. This is what I'm impassioned by. I love it. I love telling the story. I want you to tell the story. I want you to learn how to tell those stories. I think that's a take-home message that I definitely want to leave with you. It'll make you wonderful people. It'll make you better scientists, and it will help issues like I'm talking about tonight. So with that, I really wanted to leave some time for questions that you have, comments that you may have. Open it up for anything that you want to talk about, public health related or otherwise. You've heard me enough, so yes, questions.
I had a question a little bit about the aspect of community, and I was curious to know what you think of the role of the individual and individualism is within the community. I remember when I was applying to Houghton, they had asked me, like, okay, you're going to a Christian school, but you are aware that there are going to be people that disagree or don't have the same beliefs, and I'm just interested, like, within the efforts of public health, how do you balance those that disagree or want more individualism, but also maybe want to help better the community?
Yeah, great question. And you know, in some ways, I view that question in terms of what I've done in my career. I look at myself as a people leader at this point. All that science that I learned and used early on in my career, I still use it. It's a foundation for who I am. But I have developed over the years, largely because of the foundation that was developed here in a liberal arts education, that there's other aspects that come into play. And so, I think to answer your question, yes, sometimes it's difficult to find that balance. It's difficult because we do sometimes have differing opinions, and that's okay. I mean, frankly, I think that's a good thing, because if we all agreed upon the same thing, I don't think we would uncover things that need to be identified. You know, it's discourse. And part of that, I think, is finding a discourse where there is safety, there is trust, and it's fostering those kinds of conversations. You know, having a conversation with somebody that completely disagrees with you, but assuring that they trust that what you're saying to them is something that isn't going to be negatively impactful to them. It's, in my opinion, it's perfectly okay, and we've seen this in public health where there's a disagreement in terms of how to accomplish something. Work your way through it. You know, sit down at the table. If you can, you know, pray over it. Maybe not collectively, but individually. And think about what is the way that I can have a meaningful, safe, and trusting conversation with somebody else. There's no easy answers to some of these difficult situations. Yes, there are individual aspects of community. There's no question about. But I think fostering the concept of community goes a long way to alleviating some of that tension, if you will. Really describing, and this goes back to my aspect of education and awareness. If you can foster that concept of community, that together, we can identify or create the resources necessary. Collectively, we're more powerful as a group than we are individually. I think that kind of messaging goes a long way to fostering the idea that individualism can't be sustained the way community can.
Thank you.
Yes?
Thank you, Dr. Zimmerman. This was fantastic. You talked initially about the historic broad-based support for health and public health and some of the beating that public health has taken in the last couple of years. Obviously, communication is a part of that. Another part that seems to be obvious is the politicization of public health. Do you have hope that moving forward in trying to reestablish that broad-based support, that we'll be able to depoliticize public health?
I do have hope. I think it's going to be a challenge. And I hope I'm wrong. I'm afraid that one way in which this may occur is by hitting rock bottom, if you will, and recognizing that. I'm hoping that's not true, but no, I think that clearer minds will prevail eventually. It's going to take some time to mitigate some of these political aspects of what's happening, but there's so much tunnel vision as I see it right now. And people aren't really thinking about the values that public health has had historically. And so I use examples all the time. Vaccine is one, but very heavily politicized. So I try and avoid that one. But how about seatbelts? How about seatbelts? That is a public health initiative that came out of CDC decades ago, right? Do people squawk about having to put a seatbelt on? I don't think so. Yeah, do we have the data to support that it saved lives? Absolutely. And so it's an example, but I think we need to start as public health communicators, we need to start pulling out those examples of how public health has benefited our society rather than stepped on individual rights and such. I have hope, I really do. I think we've had a very tumultuous 5 years, so to speak, from a political standpoint. Do I think it's going to completely go away? Perhaps, perhaps not. We're in an era that we're still trying to find our way with social media, etc. We provide some really easy access to folks to provide misinformation, etc. How do we combat that? But there's a lot of brilliant people in the world of public health. And in medicine and in related fields. And I think we're going to be able to get our arms around this. I really do hold out hope. As much as I said, we're in a crisis. And we may or may not have hit rock bottom at this point. I don't know. But, I think we're going to climb out of it. I do hold a lot of hope. And that's based on, 30 plus years of experience.
So I think we probably should wrap up the public questions. Earlier, you made your email available.
And there it is.
There it is. All right. So read that so it's in the camera.
Yeah, and so here's my pitch to all of you. I realize that you may not have ideas, thoughts, questions, comments, or whatever right now, but I give you the opportunity to email me. My email address is zimmerms780@gmail.com. That's my personal email address. Please feel free to reach out to me. Just identify yourself so I know who you are. But if you have questions about a career in public health, if you have questions about things that I've talked about tonight or otherwise, I would love to have the conversation with you, whether it be through email or via phone, whatever. I encourage it. And spread the word, please. Spread the word. I'm perfectly okay with that. I feel that it's one of the things that I'm charged to do.
Yeah. So on behalf of Houghton College and our students, thank you. This is a token for your time. Came up on his own dime, on his own time, to make sure that he's available to you. So take advantage of it. You're a blessing to Houghton College. Thank you for offering that value to us tonight. I would be remiss, you can stop that. I would be remiss if I